You know what would be absolutely horrifying? A healthcare system where you can get sick and not go bankrupt. I know. What's next? Affordable insulin? An ambulance that doesn't cost more than a semester of college? Madness. Let's talk about single payer healthcare, or as your Fox News uncle calls it, government death panels. Let me hit you with some numbers. U.S. healthcare spending per capita over 12,500 per year. Countries with single payer, Canada, about 6,300. The UK, 5,300. Japan, 4,300. Same life expectancy, lower infant mortality, fewer people die because they can't afford a doctor. But yeah, we're the ones with the best system in the world. Meanwhile, in our capitalist wonderland, we pay more than twice as much for the same medications, an average of $2,600 just to deliver a baby with insurance. $500 to ride in an ambulance, but don't worry, they'll still bill you while you're unconscious. And yet, every time single payer comes up, here comes some bootlicker yelling, but in Canada, you have to wait for a hip replacement. Yeah, because in America, you don't have to wait. You just don't get one unless you can mortgage your house or marry a surgeon. Let's talk efficiency. Private insurers spend around 15 to 20% of your premiums on overhead, CEO bonuses, and marketing. Medicare, around 2% overhead. Because when you're not trying to sell someone a platinum tier PPO with an $8,000 deductible and a you're still screwed clause, you can actually focus on care. And let's not forget, we already have single payer systems in the US. They're called Medicare and the VA. You know, the systems veterans and seniors use. But when we suggest expanding that to everyone, suddenly people start foaming at the mouth like we suggested giving healthcare to criminals. Or worse, poor people. Newsflash. The number one cause of bankruptcy in America is medical debt. In Canada, zero. Nobody loses their house in France because of an ER visit. In the US, we've got GoFundMe listed as a healthcare provider. But hey, keep telling me how choice is important. Like anyone's out here comparing networks while bleeding out in the street. Let me be clear. Single payer doesn't mean worse care. It means no premiums, no copays, no deductibles. It means everybody in, nobody out. And the only people against it are the ones profiting off of your sickness. So yeah, let's not do the thing that saves lives, reduces costs, and boosts public health. Let's keep patching up the broken healthcare system with thoughts, prayers, and $1,200 monthly premiums.